All right. Hi, everybody. Thank you for joining us for our fourth health insurance town hall. We've been doing a series of health insurance town halls through the Department of Vermont Health Access to help inform Vermonters about the new health insurance opportunities available through the American Rescue Plan Act. My name is Zack Goss. I'm a representative from the Department of Vermont Health Access. We'll be joined today by our in-house Department of Vermont Health Access expert, Sheehan, who's a senior policy analyst with the department. And we'll also have representatives from our carriers, Blue Cross Blue Shield of Vermont and MVP Healthcare. So we're looking forward to answering your questions and talking about the increased subsidies and some important dates to keep in mind this late summer, fall to think about when it comes to your health insurance. So without further ado, I'm going to let Sean kind of kick off what we're going to be talking about today, which is going to focus a little bit more on those who have enrolled directly through the insurance carrier historically and might want to think about coming over to Vermont Health Connect with their insurance plan so that they can save additional money on their health insurance. So Sean, I'm going to kick it over to you. Sean, I think you're on mute.
Great, thanks. Sorry about that. Yeah, great to be here. Happy end of summer. We appreciate folks coming out to join us here and to talk about the town hall. As we've talked about in the last couple town halls, we've started with a couple of quiz questions, as I warned everyone, and until I heard feedback that people hated it, I would keep doing it because I like the quiz questions. So I have two here to start today. We can jump right in to those. They're up, Zach. Is that right? The first question is how much money can a couple earn in 2021 and still qualify for tax credits to lower the cost of the health plan they buy through Vermont Health Connect? Again, assuming they're buying a couple plan, a two-person plan, not an individual plan. And these are the options. If everyone thinks out your answer, circle it on your screen. Not high tech enough to have polling here, but you can shout it out at home. Anyone who answered that A, at 68,960 actually is not correct. If we had done this presentation 6 months ago, it would be right. But thanks to the American Rescue Plan, the threshold is now higher. The second answer, people that guessed 94,500. That's the eligibility threshold now for individuals. People that are in an individual plan can have incomes up to $94,000 and still get subsidies. So significantly more, even for individual plans, than what used to be the subsidy threshold for people in couple plans. But the answer is even higher now for couple plans. So people who are in couple plans, people who are in parent-child plans, or people who are in family plans can all have incomes over $180,000. It's up to over $250,000 for our family plan. So it's pretty significant. And people who I gave that last answer, the 211,541, if we that answer A would have been correct 6 months ago, and if we do this 6 months from now, or even I guess 5 months from now, that $211,000 will likely be right. It hasn't been officially confirmed yet, but it looks like that's going to be the couple plan subsidy threshold for 2022. So all of that means, as we'll talk about today, people who are in who are in health plans directly enrolled through Blue Cross or through MVP, with most incomes that most people have in Vermont, will be able to get subsidies if they transfer over now for each month for the remainder of the year, and will also get even more subsidies likely for 2022. The question number 2 so the question is, great, you qualify for lower cost insurance, but how much lower? And it's it's a sliding scale for people who are individuals right now up to that $94,000, right, or earning right around $94,000. They wouldn't be getting much. People who are earning $50,000-$60,000 would be getting a lot. But what does a lot mean? How does it all work out too? Is kind of the subject of quiz question number 2, of all the people who previously had incomes too high to get financial help. In other words, those individuals over $51,000, or those the couples over $69,000, previously didn't get any financial help, had to pay full price beginning of the year. Now they either were already enrolled with Vermont Health Connect, or they transferred their plan over from Blue Cross or from MVP, still keeping the same insurance company they had, still having their deductibles transfer over. It's the same plan, but how much less are they paying on average? People who guessed $100 per month, that's not right. $280 either, and so it's actually $430 per month. So that, again, that's gonna, that's the average. There's going to be some people who are just saving a few dollars per month if their incomes are right near that threshold. There's other people who are going to be earning, I'm going to be saving even more than this. There's some people who will be saving over $1,000 per month, but on average it's $430, and that's every month that you're enrolled through the marketplace, through Vermont Health Connect. So that's one of the things we're talking about today. Is probably a good segue. Last slide I'll show is just a couple tips here on the homepage. Is 3 links to point out. Is that when you're on there, if you want to see what you don't care so much about the average, you want to know what you'd be saving. Plan comparison tool, shopping cart link right there from vermonthealthconnect.gov is a great tool. That American Rescue Plan Act link, if you're direct enrolled, that link, you'll see there's instructions for different people, whether you don't have any health insurance, what you should do to sign up. If you're directly enrolled with an issuer, what you can do to transfer your plan over. And finally, just the phone numbers. We have an assister network, more information online. So those are resources for people to look to. Pass it back to you, Zach.
Thanks, Sean. That's a helpful intro as usual for our conversation today. And before we continue, I just wanted to overview how the Q&A box works for our town hall today. So there is a question and answer icon on your screen. If you select that icon, you should be able to type in your question to us, and we are trying to answer all of your questions live today. And again, those of you who are tuning in later, this will also be recorded, so you can tune in and certainly ask your questions to our inbox at a later date if you'd like, to our Vermont Health Connect inbox, which you can find on our website. But for now, please type in your questions and we will get those to the expert, whether it be Sean or one of our carrier representatives, to get you the best answer we can. So for the rest of today, we're hoping to, in addition to taking questions from customers, really focus on, the savings that customers will experience, like Sean just alluded to. Talk a little bit about what the transfer process is like. So transferring from the carrier to Vermont Health Connect and what reservations customers might have or have expressed to the carriers and to Vermont Health Connect, and kind of clear up any misconception there. And then just talk more about how they can smoothly make that transition and feel confident in their plan going forward. So Sean, I don't know if you want to kind of talk a little bit about the transfer process or the savings anymore before we jump into questions. We do have one question in the queue, so we can either go to that question now, or we can kind of dive into a little bit more of the content. We are going to ask we do want to get an opportunity to hear from the carriers as well about what they're kind of seeing and the volumes of transfer that they're seeing. And finally, before the end of today's town hall, we're going to again share the resources that we have available to communicate this externally to people who might be interested in this information. So Sean, I'll pass back to you now.
Yeah, that sounds great. Yeah, I'm happy to jump into the questions as they come. I think to tee up the piece you said, Zach, I mean, we expected to have higher volume of people transferring based on incomes. As we said, we thought most people who were direct enrolled would qualify. So we'll talk a little bit, as you said, hear from everyone here about what we've heard. But if there's folks on who want to share their experience, if you're direct enrolled and have checked it out, if you want to put that in the Q&A box too, it doesn't have to be a question per se. Anything you've shared or experienced, please enter that as well. But should we hit that question while it's? Yeah.
That question. And it is straightforward. I have insurance through my spouse in New York, but it is not accepted in Vermont. So Sean, there's, probably actually it's a straightforward question, but a lot of answers and a lot of information that we probably need to answer it sufficiently. But maybe you can kind of tackle it, what this person might be thinking and wondering.
Yeah, absolutely. All right, so I think, as you say, Zach, I definitely think for any particular situations that people are in, it's best to call the toll-free number. We also have the assister directory people can find an assister in their county. I'm assuming, based on the question, that the person asking the question here lives in Vermont, and that's why they want to use insurance in Vermont. And I'm guessing that it's likely employer-sponsored insurance has a particular network. Again, they don't say which insurance company they have. It's likely it's neither MVP or Blue Cross. It's likely it's a insurance company that just operates in New York. And while there isn't it's a statement, not a question, I'm guessing they're getting at, would they be eligible for lower cost, for discounts on their insurance, eligible for subsidies. And again, I think those situations they'll want to call and talk through. It's likely that they won't be, because if you have an offer of insurance, whether that be Medicare or affordable employer-sponsored insurance, then you don't qualify for subsidies. If your employer requires you to pay to contribute, and if that required contribution for the lowest cost health plan that they offer you is above a certain threshold, I believe 9.83% of household income for a one-person plan, then it's deemed affordable and you can't get subsidies. If it's higher than that threshold, then you'd be able to get subsidies, just like anybody who didn't have an offer of of insurance. But again, I think there's a lot of hypotheticals, a lot I'm sort of reading into or assuming there. And I'm not sure if on that particular question, Zack or
and I think sorry, I got a little echo. For the individual asked the question, please feel free to circle back to us with follow-up. Again, we're taking questions live and trying to answer live as well. So if there's additional follow-up that you need, you can ask here. Alternatively, we also want to make sure people's individual situations are private for themselves, so they can also, we don't want you to have to share too much information in this forum. So please, like Sean said, you can meet with an assister, or you can always call our customer support line. I'll just throw out that number now because I do have it off the top of my head. It's 855-899-9600. That's a way to really get the best answer that's personalized for you. So let's go to the next question, which is for the November enrollments, which I'm guessing is they're referring to the open enrollment period, which we can touch on a little bit, Sean. Will the question of receiving unemployment benefits in 2021 still apply? So that's a great question. Really important, and I'm going to pass it to Sean to answer.
Yep. Yeah, that's a great question and probably a good segue to talk about dates a little bit. So when we talk about right now, the main focus we're going to be talking about today is the opportunity for direct enrollees to transfer their plan into the marketplace. They can do that at any time of year, anytime this year, anytime next year. The benefit to doing it sooner rather than later is that you'll qualify for subsidies for every month that you're enrolled through the marketplace. So if you transfer your plan between now and what's the 31st, next Tuesday, between now and next Tuesday, you could have your plan start with Vermont Health Connect as of the next day, as of September. And you would have to be fully paid to transfer your plan. You have to be fully paid with Blue Cross or MVP. If you had already made your September payment, you would have to make the payment to the marketplace to start the plan with Vermont Health Connect. You would be able to get a refund, from your issuer. But again, that would be up to you, and it might, depend on how big of a subsidy you'd be getting as to whether you wanted to go that route or you just wanted to wait and start it in October, since you've already paid your issuer for September. So that's how it works for direct enrollees. For people who don't have any health insurance at all, October 1st is the deadline under the COVID special enrollment period. Normally, you can only enroll during open enrollment each fall, which we'll talk about in a second. But this year, due to the public health emergency, there is a special enrollment period where people who don't have insurance can come and sign up. So people who sign up between now and, again, next Tuesday can have insurance starting September, start taking advantage of these lower costs they may qualify for. People who come in between September 1st and October 1st can start on October 1st. Then, as question here alludes to, for the November enrollments, as you said, Zach, assuming the questions are referring to 2022 open enrollment, that opens on November 1st. The plan comparison tool for 2022 will launch on October 15th, so a couple weeks ahead of open enrollment. And I think, as this person is referring to, the current plan comparison tool has a question asking if anybody has received 2021 unemployment benefits. The reason the question is in there is there was 3 provisions of the American Rescue Plan. Number 1 was to give more subsidies to people who already were getting subsidies to make health insurance even more affordable for them. Number 2, to make these subsidies, these tax credits available to people who previously were earning, whose incomes was previously too high to qualify for financial help, to get rid of that benefit cliff that we had prior to the American Rescue Plan. And the third benefit was that anyone in the household qualified for unemployment compensation in 2021, they can get even larger discounts, can qualify for $0 silver plans with very low out-of-pocket costs. Now, those first two provisions I referenced, the income-based subsidies, those continue into 2022 for both 2021 and 2022. However, that unemployment benefit piece is only for 2021. So the short answer to your question is no, the plan comparison tool, if you go to it on October 15th, see the 2022 plan comparison tool, it'll no longer have that question about unemployment benefits, and there no longer will be that additional discount for 2022. So that's the main piece. Now, with all of these pieces, there is a chance that Congress could renew them, and we've heard talk of we know the American Families Plan is the next piece of legislation that Congress is looking at this fall. We've heard there's some discussions of that benefit being in there, but under current law and under current plans, that question will not be on the tool.
Thanks, Sean. Again, great. And there are a lot of kind of moving pieces to all this legislation, and we're trying to synthesize it for you as best we can. So Sean, I don't know if it makes sense to talk a little bit now, going back to those direct enroll folks and talking a little bit about, specifically what's changed for them, really, because historically, in my understanding, since the inception of the marketplace in Vermont Health Connect, there was really, I think, what we call the benefit cliff. And it meant that at a certain income, really, you lost eligibility for any kind of subsidy or any kind of financial help. And in turn, a lot of people went directly to the insurance carrier if they fell into that group of people, because you have to come to the marketplace to get your subsidies, and if they weren't going to get subsidies, they would go directly to the carrier. Well, and through the American Rescue Plan Act, that's changed, and people really might want to relook, and maybe we should just touch on that a little bit and just kind of open it up for a little bit more conversation about what we're seeing in terms of people coming over, and if carriers are having a similar experience to what we're seeing.
Yeah, that sounds great. Yeah, I think now would be a great time to loop in our guests. We have Kelsey Thornton and Krista McDowell from MVP Healthcare. Jordan Benson's here from Blue Cross, Blue Shield of Vermont. And we've been working very closely together, Department of Vermont Health Access, with MVP and with Blue Cross, and supporting them, and they've both been active in reaching out to members, sending multiple letters. In Blue Cross's case, a letter and an email, and MVP's case, and even still, we've found just over 10%, about 12% of folks who were directly enrolled in the spring have come over. So we've been a little bit stumped by that, trying different ways to engage people and trying to kind of put our ear to the ground and hear what might be some obstacles. I know in our case, we've heard a few examples of people who have, they might be a couple, but they might only need a single plan if one member of the household gets insurance through work, or if one member if one spouse is 65 and on Medicare. Together, their household income might be, over $100,000. Well underneath that $189,000 that the threshold for a couple plan. But because they only need a single plan, it's that $94,000 threshold that applies. Is one piece that we've heard. A second piece is that early on there was some questions about deductibles. People were worried that if this mid-year they'd already had had some procedures or had some doctor's visits and had met their deductible and didn't want their deductible to reset by changing. And that's something I think we've assured members, both Blue Cross and MVP have assured members in their letters and communication as well, that as long as they transfer their plan into the marketplace and they stay with the same insurance company, it's the same plan, those deductibles carry over. So that's not a reason not to transfer. Beyond that, I don't know if any folks if Jordan or Kelsey, if you've heard other examples or other reasons people have given for why they.
Let's start with. Oh, I think I'm unmuted. Yeah. I'm gonna turn it over to Jordan. He's the first one to pop his camera on, so I'll pass it over to him. Yeah, let's hear what you've been seeing.
Hi everyone, I'm Jordan Benson from Blue Cross. So we've seen, exactly what Sean has mentioned. There's certain eligibility membership tiers that may change the household income to get subsidies. In the beginning, when the American Rescue Plan Act was implemented, the reflective silvers plans caused some concern because there are lower monthly premiums compared to the silver plans through Vermont Health Connect. But now the subsidies are live. So, again, if you're on a silver plan, you will get the subsidy if your income qualifies. So, the cost difference won't be much. And then, if you switch over from Blue Cross directly to Vermont Health Connect to get those subsidies, whatever you've accumulated towards your deductible out of pocket will continue for the rest of the year based on your Vermont Health Connect plan, as long as you stay with a Blue Cross sponsored plan through Vermont Health Connect.
Great. Yeah, thanks, Jordan.
Yeah, thanks, Jordan, for the clarification. Kelsey, I don't know if you are wanting to share any other feedback. I'm not sure if I'm not able to see you on camera, so I'm hoping that you can hear me and you're there.
Hi, yes, I can hear you. I was just able to unmute myself.
Okay, perfect.
Yeah, we actually, I mean, similar to what Jordan said there too, but other than that, we didn't have any other really specific thing we were hearing besides what was already mentioned. And I had just asked Kristen on the side too to see if she had heard anything, and she had not heard anything specifically yet either. So I don't have too much to add to that.
Great. Yeah, thank you. Thank you, Kelsey. And I think one other piece, one other consideration, just with 2022 rates being finalized just this week. I guess next week will be certified and be official. And as I noted, they'll be up on the plan comparison tool October 15th. With those 2022 rates, one thing that the legislature did this year and the governor signed was a bill to unmerge the small group and individual markets. And this is getting more in the weeds than we probably want to for a town hall. But what it means is that because people in the small group insurance tend to be a little bit younger, a little bit healthier than people in the individual market. They were effective by having the same rates for everyone. The small group had effectively been subsidizing the individual market for the past several years. Number one, and number two, the way subsidies work is they're pegged to the second lowest cost silver plan. So if the premium of that plan goes up, people get more subsidies, and at the same income level, you don't pay anymore. So there's been protection for middle income folks, lower middle, up to that 4 times the federal poverty level for the first 7-8 years of the Affordable Care Act. But people who are above that threshold, that cliff we were talking about, weren't protected, and they had to pay increases each year. And so with the legislature and the administration seeing what the American Rescue Plan was doing, and that it would provide protection for everybody that didn't have offers of other health insurance, to cap them at 8.5% of their income for the second lowest cost silver plan, which is really how those effective thresholds we're talking about work. They separated the market, which is helping small businesses at a time where small businesses have really been hurting with the pandemic, so that they won't see the big health insurance increases that they've seen in the past. And the majority of people who get their health insurance as individuals through the marketplace, through Vermont Health Connect, will also be protected from those increases. And the people who won't be and who will see increases are folks who are direct enrolled with the insurance issuers, and who don't qualify for subsidies. So that's something that I think we really want to get the word out prior to open enrollment, because I think people that hadn't seen the letters that came this spring and this summer from Blue Cross and MVP are meant to get around to transferring, will see some sticker shock there with those letters that come in October or November. And so I think at that time, we certainly expect more people to come over, take advantage of those subsidies for 2022, but really want to relay that there's no reason to have to wait for that. If you want to come this week and call over and start getting the subsidies in September, that's potentially an additional 4 times as much of that amount we're talking about. If it's at that average $430 savings, over 4 months, that's $1,700 or so. And yeah, happy to take any other questions, and also really interested in hearing about people's experiences and thoughts.
Thanks, Sean. And I just wanted to clarify something, because I think in light of making this transfer to, we're talking a lot about transferring to Vermont Health Connect, and I think we've probably said it in some shape or form, but just to clarify, folks who are direct enrolled with the carrier and not at all involved through Vermont Health Connect, even if they're eligible for subsidies, would not be able to receive them as long as they are direct enrolled through the carrier. They need to come through Vermont Health Connect to receive any of those subsidies, or even have the chance of receiving subsidies. So even if they have been direct enrolled in the past, the reason why we're trying to get folks back over here is because there's no way to get those subsidies through the carrier when they're enrolled directly. I have that right, Sean? Yeah,
that's correct. Yeah. So once people come over to the marketplace, you can choose how you want to get those subsidies. If you want to take them, have them applied as a discount on your bill each month, that's called advance payment, the premium tax credit. You can choose to do that. If you'd rather continue paying full cost. Maybe if you're not sure what your income will be and don't want to owe money at tax time, at least by coming over, you'll have that opportunity when you file your 2021 taxes next winter, to get credit based on what your income for the year ends up being and the number of months you were enrolled through the marketplace. So that's absolutely right, Zach.
Thanks. All right. So moving right along, I want to make sure that we touch on just some of the resources available for people. We don't have any questions in the queue at this very moment. That could change. But I do want to touch on some of the resources we have available for folks who need more information or are having some need additional support making their decisions. So I do know that on our website, on the Vermont Health Connect website, we've given some pretty extensive examples and information about how the American Rescue Plan Act affects individuals' insurance costs and situations, and as well as to those who may be listening who are involved in more of a stakeholder or an outreach role. We do have some things on our website posted that can be shared, whether they be article or social media posts that capture the basic overview of what the American Rescue Plan Act is offering. And we really want people to share those widely. You know, we have flyers available that people can download and post or share or email however they see fit, because again, this is, you know, this opportunity is not going away, and that it is available in 2022 as well. But as Sean has mentioned, there are some important dates coming up where if folks haven't taken action now, they might be missing out on some money, and in some cases a lot of money, if they don't act before before the end of the special enrollment period, if they haven't come over yet. So Sean, anything on that?
Yeah, I think that's a great point, Zach. I think the resources that you underscored there on the website, from the assister directory to where people can find people right in their own counties to talk to those educational materials, the health insurance literacy materials, to the sample social media posts and newsletter articles and videos. I think to the extent people can share them with family, with friends, with neighbors, it's really important for a couple of reasons. And a big one is that Vermont's always been a leader in health insurance, making health insurance available to Vermonters, having a large percentage of the population covered by insurance. We're behind Massachusetts, but we're right. We were second for a long time. Right there in the top few still. But with these American Rescue Plan benefits and the new costs, the new lower costs, the people who don't have insurance can qualify for. I think it really gives us an opportunity to drive that uninsured rate to record low levels. And the reason I say that is the household health insurance survey that's done every 2 or 3 years in the state. The last time it was done, so there were fewer than 20,000 people in the state that didn't have health insurance. But the majority of those, when asked why they didn't have health insurance, said that the cost was either the only reason or the primary reason. And so to the extent that we can reach out to friends, to the neighbors, to other people who might not have health insurance, who might have looked a year ago, 2 years ago, 5 years ago at the cost of health insurance, saw that they didn't qualify for subsidies, or saw that they qualified for lower costs, but it was still more than they thought was worth it, or more than they could afford. I think it was really important to get that message out that the math has changed. The American Rescue Plan has significantly changed what health insurance costs for Vermonters. So if you haven't looked at the plan comparison tool, and if you haven't looked at it since May or June, since the American Rescue Plan went into effect, please take another look. And we have another question.
Yeah, thanks, Sean. I'm not sure if my screen popped up there because I was kind of trying to prepare for the next question. So we've got a great question here for Blue Cross Blue Shields and or MVP reps, and I think actually Sean, you'll probably want to chime in on this one too. What is the main difference between plans such as Silver 94 versus Silver 87 versus Silver 77, etc.? And additionally, is it the specific services and prescriptions covered? And I'm gonna just well, I'm gonna defer that, Sean. Why don't you kick that off, and then I think we should go to the carriers.
Yeah, that sounds great. I'll kick it off. Yeah, and then right, Kristen and Kelsey or Kelsey, and then Jordan, if you want to talk about some of the specific plan designs and the difference between your standard and the high deductible consumer directed, it would be a good time to go there. But I'm happy to tee up what the Silver 94 refers to. And actually, Zach, if you flip back, I'll flip back to the screen here. We'll just throw up. If you do look at the plan comparison tool, which we have up on the screen here, when you use the plan comparison tool, it's going to ask you how many people in your household, what ages are they? If you want to put in health status or if people have any particular health needs, you can, but you don't have to. It'll give you an average for your age if you don't, and your income level. And I think as the earlier questioner asked for 2021, we also ask if you've had unemployment compensation, but again, that won't be there on 2022. Once you answer those questions, it tells you what you qualify for financial help. Let's see, Zach, did it flip off of? That's strange.
I don't think we weren't able to present that slide because I think the sharing stopped for your slides. So you can
okay.
reshare that, or I brought up the plan comparison tool right here.
Oh, right. Yep. Yeah. Sorry, I just reshared. I don't know if that.
Okay. Perfect.
Yep. Yeah. So after you enter the income and that information about yourself, you'll see what you qualify for financial help. And there's two pieces of this financial help, just as there's two pieces of how you pay for healthcare when you have health insurance. There's your total costs consist of number one, your monthly premium. The premium is what you pay each month to have insurance, to have that peace of mind, to have the covered services that come with it, have the free preventive care that you don't have to pay any copays or anything for that preventive care. And then the second piece is your out-of-pocket costs. That's things like copays, deductibles. There's a maximum out-of-pocket limit on the most you can pay in a year. Then your insurance company will pick up the rest. And as far as what those covered services are, those depend on, as far as what you pay for those covered services, those depend on which plan you're in. In general, a bronze plan will have the lowest monthly premium and the highest out-of-pocket costs, whereas a platinum plan will have the lowest out-of-pocket costs, but the highest monthly premium. So in general, somebody who knew they were in poor health, knew they needed a lot of doctor's visits or operations or things coming up, somebody in that situation might be more inclined to look to a gold or platinum plan. Whereas somebody who was more healthy, maybe tended to be younger, was willing to take on a little more risk of higher out-of-pocket costs in exchange for a lower monthly premium, they might be more inclined to look to a bronze plan or possibly a silver plan. Now, the exception to that rule is for people who's based on their income or by virtue of having unemployment compensation for this year, in which case it doesn't matter what your actual income is. If you can qualify for a cost sharing reductions. And cost sharing reductions mean you can have an enhanced silver plan, which is a plan that instead of having what's considered an actuarial value of 70, as most silver plans are, meaning on average, when you go see a doctor, your insurance company will pay about 70% of the costs, and you would pay the other 30%. That's what a standard, what a typical silver plan would be, whereas a platinum plan would have an actuarial value of 90, meaning on average, you go see a doctor, you're going to pay about 10% of the bill, your insurance company is going to pay about 90%. If you qualify for these enhanced silver plans, particularly a silver 94 or a silver 87, it means that you're only paying the premium of a silver plan. And in this case, the premium of a silver plan minus $662. This is an individual with a $25,000 income, meaning they'd be able to find silver plans that would have, $0 net premium after that subsidy, or a $10 net premium after subsidy, depending on which one they choose. And the silver 87 means that on average, their insurance company is going to be paying 87% of their bill. They're only going to be paying 13%. In the case of silver 94, they'd only be paying 6%. Their insurance company would be paying 94%. That's a lot of numbers. I know a lot of pieces thrown around, babbling, rambling there. So if I lost you, like the one takeaway is, if you're on the screen and you see silver 94 or you see silver 87, that you qualify for those, your plan selection just got a whole lot easier. Because you can get a silver plan now under the American Rescue Plan for a very low premium, and your out-of-pocket costs are going to be just about as low or lower than they would be if you had a gold or platinum plan. So a silver plan is going to be guaranteed to have the lowest total cost if you qualify for a silver 87 or silver 94. Now, if you qualify for a silver 77, 73, it's a little more complicated. We'd encourage you to look at the plan comparison tool. You'd see, based on what your needs are, it may still make sense to go to a gold plan. The premiums for gold plans and silver plans are very similar. And so again, you may want to take a closer look at the plan comparison tool, and you can at this level too. But really important piece, and I didn't directly address, I should have directly addressed right off, whether there was different services or prescriptions that were covered. And this, I think, would be a good segue to our issuer partners to join. But the bottom line they can't emphasize enough is that there's no difference in covered services. There's essential health benefits that every plan offered through the marketplace includes in their covered services. Things like emergency room visits, ambulance visits, physical therapy, maternity, pediatric, vision, and the list goes on. But they're the exact same covered services with the bronze plan, silver plan, a platinum plan. It's really just how you pay for them that's different. And if you qualify for these enhanced silver plans, that's making them a better bet for you. I think to pass that to, do we want to jump in, Kristen or Kelsey, with specifics about the various plan designs that people may want to consider within those enhanced silver plans and more broadly, because I think the discussion probably applies across the board. And then Jordan can jump in too.
I believe it was shown the way the plans are set up, they're broken out into those 4 enhanced levels. Either the members can choose from that set of 4 plans, or they can apply their tax credit against the vast portfolio of plans available to them. And it's really whatever, best suits their needs, what they're comfortable with.
Yeah, that's right. And yeah, and Jordan can jump in too. But I think, as you'll note, with each within those silver plans and those 4 tiers, you're only going to, plan comparison tool, or when you apply, will tell you whether you qualify for silver 94 or silver 87. So that's not something that you as a consumer has to think, oh, do I want a silver 77 or do I want a silver 94? You qualify for which one you qualify based on your income. And you can't, if you qualify for one of those silvers, you don't have to worry about getting out of your normal silver plan. You just enroll in the silver plan and you'll automatically be put in that additional benefit that will lower your out-of-pocket costs. But you'll see within each of those plans that within each of those levels that you still have 8 silver choices, 4 from each issuer, which include both standard plans and the issuer specific plans, include both standard deductible plans and the high deductible plans that you can pair with the health savings account. And Jordan, if you want to jump in on any of those distinctions there that people may want to consider.
Yeah, to your point, if based on your information that you input in the plan comparison tool, if you qualify for one of those enhanced silvers with the cost share reductions, you could look at, the 4 silver plans, that are available through Blue Cross. But ultimately, each enhanced silver can change the deductible out-of-pocket copay based on that level. Then if you had to pay, if you didn't qualify for that but purchase a silver plan. So again, with Blue Cross Blue Shield of Vermont, we have the 4 silver plans, and there's, the enhanced silver 94, 87, 77, 73. So really, it's, it can change what your deductible would be. Your copays could be based on what you qualify for. And you can compare that up to a bronze, which is a lower monthly premium, but it does result in possibly having a much higher deductible out of pocket, or upgrade, pay a little bit more per month in the gold that could be subject to a lower deductible. So it's really based on what the customer would qualify for and what options would be best for them.
Great. Thanks, Jordan, and thanks, Kristen. So, yeah, those are great points. And when you're on the plan comparison tool, you can compare those plans side by side. You can look, if you click on the blue letters of a plan name, that will take you right into more details about that plan. And one of the things that it offers on that page is a link. You'll see a link that says view the doctor directory, and another one that says view the prescription directory, and that will take you to the Blue Cross website or the MVP healthcare website to their what they call it, the prescription formulary, where you can see which prescriptions are generic, which are seen as preferred drugs and so forth, and what the copays will be, structure in those benefits. But those are all applied, and the doctor directory, correct me if I'm wrong, Blue Cross or MVP, but those are the same. Blue Cross's directory is the same across all of its plans, and MVP's is as well. So it's not something that you'd have to think about, oh, if I'm in a silver plan, I would have this service covered, or I wouldn't be able to, I'd have to be, I wouldn't have a particular drug covered, or, I wouldn't be able to see a particular doctor. If they're in that insurance company's network, if they're in their the covered services, how they're treated, it's the same across all of the plans. Where it will differ could be whether it's covered before or after the deductible, what the copay might be. So really the distinction is just down to how you pay for your plans. And again, looking just at the premium and your out-of-pocket costs. And that's something that when talking to the issuers and looking at the plan comparison tool, you can get a good handle on.
That's correct. Just a caution.
Thanks, Kristen.
Sean, it looks, and everyone, it looks like we have one more question, which we probably have time for. We've got 4 minutes left in the town hall today. So this question is related. On the plan comparison tool, where it shows details of all the plans, is Silver 4, it sounds like it's showing Silver 4. Does that equal Silver 94 plan? If the tool said you qualify for, say, Silver 94 or Enhanced Silver 94, which detail plan is that referring to?
Oh, great. Yep, that's a great question. So I think to back up that screen I shared before, where in that case it was the Silver 87 based on an individual who said they had a $25,000 income, said they qualified for that $662 discount on their monthly bill, no matter which metal level they chose. And if they wanted to choose a silver plan, they qualified for Silver 87. When you next click on that link that says show me the plans, in that case, all of the silver plans you see are going to be the Silver 87 variation of the silver plan. You won't be seeing any regular silver plans or Silver 73 or 77. And in the case, I guess, as this person asking the question is, the Enhanced Silver 94, which is what you'll see if you had any for 2021, if you have any unemployment compensation too. Again, you hit that button, show me the plans. All the silver plans you see are going to be Silver 94. You won't see any other. So when this person says they're seeing Silver 4, I believe what that's referring to is the name of one of the, I believe it's MVP, correct? That has the Vermont Silver 4 in its naming convention. So when you're on there, and you'll see some Blue Cross plans, and you'll see some MVP plans, you'll be able to, they'll have a name, and then they'll have the information about them below, and some of them are high deductible plans that you can pair with the health savings account. Others have specific benefits that Blue Cross and MVP have, and the MVP plans are Vermont plans, and there's plans that are plus, and Blue Cross plans, there's plans that are preferred and select. And so I believe that's what the four refers to. It's not related to Silver 94 or any enhanced silver. Yeah, I'm just, oh, sorry, I think you're on mute now, Zach. Yeah, I was just looking, actually just called it up. I'm sorry if I was stumbling there as I multitasked, but if the person asking sees when I'm just looking at the Silver 4, is there's a plan as MVP VT Silver 4 HDHP. So as we referenced, if you look and you're just looking at silver plans, you can sort and you can use the filters on the left there to just choose silver plans if you want. If you know if you're coming over from Blue Cross or from MVP, you'll be transferring into the same plan. So actually, it's not an issue. If you're already in a Silver 4 HDHP, you'll automatically come over to the Silver 4 HDHP in Vermont. But if you're newly enrolling, if you don't currently have insurance, if you know which insurance company you already want, you can use the filter, choose Blue Cross and Blue Shield of Vermont and the silver plan. You only see those 4 plans from Blue Cross that are silver plans. If you know you want to be with MVP and you want to be in a silver plan because you qualify for Silver 94, you can select MVP and silver, and you'll only be shown those 4 plans. And in the case of, or you can see all 8 if you want, and don't filter by insurance company. But if you filter by Blue Cross, you would see preferred silver plan, consumer directed health plan, silver plan, the standard silver plan, another CDHP plan. Whereas if you look at MVP's 4 plans, in addition to having those names, they also have them numbered. So you'd see MVP, VT plus silver 1, plus silver 2 high deductible, silver 3, silver 4 high deductible.
Thanks, Sean. So that about wraps up our town hall meeting for today. I want to thank Sean again for joining us. Thank you to our guests from Blue Cross Blue Shield and MVP. We do have 2 more town hall events in the month of September. Those will be on September 15th and September 29th. So we're looking forward to continuing to talk about this and spread the word. And please plan on tuning in or sharing that information as you can. We will have our social media postings about the event coming up, and it'll also be on our website. There's a lot more information on our website, and you can always call us or the carriers with more questions. So thanks all. Thanks to the presenters, and have a good rest of the day.